since the late summer, parents of sick kids have had to take their children to the emergency room, get a pharmacist to make children's pain meds out of adult pills, or even drive down to the U.S. for kids' Advil or Tylenol. Today, Health Canada announced 1 million bottles of drugs will be distributed to hospitals and retailers across the country. But Ontario's Pharmacists Association says a longer-term solution needs to be figured out. Health Canada says pharmacy shelves shouldn't be empty for much longer. The agency announced today it has procured loads of children's pain meds from international producers.
After next week, more than 1 million bottles of product will have entered Canada to supply hospitals, community pharmacies, and retailers, and medications will start appearing on store shelves starting early next week.
Empty shelves where children's meds should have been an issue since the summer. Dr. Supriya Sharma explains why that was.
The end of the spring and into the summer, where we had increased demand at a time where we did not typically see that increased demand. And then that's the time that the companies would normally be replenishing stocks and then moving forward to get ready for the fall and the winter season. So they didn't have the opportunity to do that. And then there was another increase in demand. So that seems to be a bit particular to Canada in terms of that late push in summer. And so that's probably why we're feeling it a bit more there.
Dr. Sharma adds that seeking help from abroad was always an option. However, the president of Ontario's Pharmacy Association, Justin Bates, says Canada can't keep relying on international aid.
The root cause is that we have very few suppliers, manufacturers in Canada. We do not have the kind of capacity within our supply chain that has the flexibility to deal with the fluctuation in demand that we've seen. Even though the manufacturers have ramped up their production by 35%, which is a record amount, you can't keep pace at that levels.
Bates says the new inventory can only last if retailers ration bottles behind the pharmacy counters.
We can't manage if people are buying 2 or 3 bottles of the liquid formulation and so forth. That's the scenario we have to avoid. But if the manufacturers keep producing at the rate they are, and we supplement that with the importation from the US and other countries, then I do think we can at least stabilize it throughout the fall, winter.
Health Canada says the country has 10 facilities that manufacture children's meds. However, just 2 of those manufacturers make active pharmaceutical ingredients. Thus, Canada continuously relies on international sources. Dr. Sharma says the government is looking to put the odds in their favor.
But we're having discussions in terms of, production overall, in terms of our approach to life sciences and pharmaceutical manufacturing, about augmenting and increasing domestic production, not only of active pharmaceutical ingredients, but also of the finished dosage products.
Dr. Sharma spoke on a theory that the shortage was due to a holdup in making Tylenol and Advil packaging that was in French and English. She said that was never the case.